A household survey discovered 30.2% of the population in Papua New Guinea was under the poverty line in 1996. In Papua New Guinea, income inequality is high. It was 0.51% in 1996. It is estimated that it would be 0.50% in 2015. In 2008, 10% of the births were underweight. It is estimated that this percentage will not be different in 2015. The amount of children who were underweight under the age was 24% in 2008. It is estimated to be 17% in 2015. The MDG Progress Report in 2010 predicted that the amount of population below the poverty line in 2015 would be 27%. Papua New Guinea attempts to achieve these goals using the Medium-Term Development Plan strategy. The Medium-Term Development Plan is a 5-year development plan that provides a trustworthy plan for investment. This plan sets sector strategies, targets, deliverables, and guess on how much this plan will cost. The following 3 midterm plans will be used to ensure the government's progress with the MTDP: creating goals to make sure they stay on the right track, identifying risks to guarantee sectors work together, separating the agency's responsibilities, arranging necessary resources. The MTDP works to make the Papua New Guinea Development Strategic Plan into noticeable results. The courses that can be used to monitor MDG-1 are service strategy. At the moment, service statistics related to poverty and hunger are limited or do not even exist. Statistics on poverty are available from the Independent Household Survey. This information is used to observe the poverty sector of MDG-1. The Household Income and Expenditure Survey observes elements of the living standards in PNG. The National Micronutrient Survey observes measurements of children under the age of 5. This report collected information on the amounts of underweight and overweight children. The Demographic and Health Survey collects data on health, mortality, fertility, education, and literacy. Development on universal primary education in Papua New Guinea is calculated by measuring access to school using gross enrollment ratios, measuring completion of education by cohort retention ratios, and measuring literacy rates to recognize the progress of the population. Gross enrollment rates increased for both female and male between 2000 and 2007. Cohort retention ratios measure that only 60% of children finish the primary level of education. Papua New Guinea is not doing as well in achieving the global target on cohort retention rates as they planned. Cohort retention ratios measure that only 60% of children finish the primary level of schooling. The MTD's target for CRR was 70% for 2015, but is only at 60%. Youth literacy rates are not up to what they should either. At 61.7% of youths were literate in Papua New Guinea in 2000, the MTDS hoped to reach a youth literacy rate by 70% in 2015, but this did not happen. Gender and gender-based violence is a serious issue in Papua New Guinea. Because of this issue, the MDG National Steering Committee considered gender culture and gender disparity to be one of the main issues for all MDGs as well as a problem for future development. To help this issue, PNG must make sure that they do everything in their power to eliminate gender disparity and to promote the empowerment of women. Boys have better access to primary schools than girls. Since education reforms have existed, improvements in schooling for boys have happened, but for girls the improvements have not yet happened. The literacy rates of boys are still higher than those of girls. The way this problem can be solved is through improvement in youth literacy rates for both boys and girls. A good sign for the future is that in most provinces, the GPI for youth literacy has improved. Papua New Guinea was one of the 25 countries in the world that was chosen to be a part of the UNICEF initiative to make girls' education better. This initiative aimed at a 10% improvement in the enrollment and retention in primary schools for girls by 2007. In the year 1990, the male percentage in primary schools was 68.1%. And 64.2% for females. In 2007, 78.2% of males received a primary education, while 70.2% for females.
The fourth Millennium Development Goal was a reduction of child mortality by 2/3 for the year 2015. Based on data collected by national consensuses, the rate of infant mortality is declining in Papua New Guinea. The rate of decline, however, is slowly decreasing. During the 1970s, the country experienced a drastic reduction of childhood deaths. However, this reduction has slowly been decreasing. The decline in this is mainly attributed to adoption by the Papua New Guinea Child Health Services of a set planned approach to strengthen and coordinate child health problems, new initiatives to reduce cases of preventable diseases such as malaria, pneumonia, and others, including buying bed nets and vitamin supplements for children. And there's also been an increase in number of pediatricians throughout the country. Some slight improvements are also attributed to an increase in women's education and literacy rates. Breastfeeding is considered the main reason why infant mortality is not higher than it is. However, there are some common preventable diseases that are causing large rates of infant mortality, such as TB and polio. The immunization program currently does not meet the demands and the needs of the nation, and an overall analysis suggests slow progress towards the Millennium Development Goal number 4. But based on the current rate of decline in infant mortality, it is likely that the goal will not be reached. Financial difficulties present a challenge in accomplishing the goal. Budget for the health sector is limited, with poor prioritization and allocation of resources. Lack of transportation and transportation networks makes it difficult for families to access adequate health care. The fifth Millennium Development Goal is to reduce maternal mortality and achieve universal access to reproductive health care. Until recently, very little was known in Papua New Guinea about the trends and levels of maternal health, including the mortality and morbidity rates. An absence of complete knowledge makes it difficult to track improvements in Papua New Guinea. There's a greater than average risk of dying during pregnancy or childbirth, too. Women outside the range of 20 to 34 years of age, women who give birth within 24 months after the birth of a previous child, births to high parity women who already have 4 or more children, and to women who are sick with anemia, cardiac disease, TB, or HIV. There's been a decline in percent of women attending an antenatal clinic and a decline in percent of women delivering in supervised healthcare facilities. The use of contraceptives has slightly increased, but still remains low for both men and especially women. It is entirely unrealistic that the maternal mortality will be reduced by 3/4 by 2015, because the rates of maternal mortality remain very high. The economic, social, and cultural factors all play a role in preventing the fifth Millennium Development Goal from being accomplished. Some of the factors that inhibit the accomplishment of Goal 4 also apply to this goal. These factors include poor infrastructure, absence of basic health services, lack of protection against malaria, and lack of effective treatment, poor human resources at delivery facilities, inadequate management of supplies, low health to worker to population ratio, corruption by service providers, lack of proper sanitation and safe water supply, and a lack of law and/or order. The sixth Millennium Development Goal is to combat HIV/AIDS, malaria, and other diseases. In 2002, Papua New Guinea was declared the 4th country in the Asia-Pacific region to have a generalized HIV epidemic. The sixth Millennium Development Goal is very difficult in Papua New Guinea due to a sensitivity regarding HIV and AIDS. There's a lack of understanding regarding transmission and stigmatization of those suffering from the diseases. There's also varying opinions regarding the degree to which HIV and AIDS are a threat to the nation. Plus, the integration of plans made to combat HIV and AIDS have not been sufficiently incorporated into the national policies. The attempt to track HIV and AIDS cases through databases is still inadequate. However, the number of test sites has increased significantly. Monitoring is still limited, especially due to the stigma and discrimination against people living with HIV and AIDS. The HIV rates have increased exponentially since detection in 1987. The prevalence of the disease varies based on age and sex, spatial differences, and geography. Over 50% of cases in 2008 reported an unknown cause of the disease, and it is possible that the AIDS epidemic is still in its infancy in Papua New Guinea. There has been a clear connection between gender-based violence and HIV infection, and the prevalence of HIV opens door for opportunistic infections such as malaria, pneumonia, TB, and many more. The weakened immune system makes these easily treatable/curable diseases highly deathly. Papua New Guinea is nowhere near meeting this goal of eradicating HIV and AIDS, or any other disease for that matter.
The first initiative that Papua New Guinea has established in their goals for sustaining their ecosystem is the Forest Inventory Mapping System. The objective of PNG's Forest Inventory Mapping System, or FIMS, is to assess the potential for sustainable commercial forestry operations by referencing forest resource maps. Forest Resource Map is a map that gives a specific layout of a forest and its I'm going to start again. The Forest Resource Map is a map that gives a specific layout of a forest and its geodatabase. It is essentially an inventory of what is living in the forest and gives information regarding the vegetation's species, age, its health, and location. This information aids the country by helping them make long-term plans on commercial harvesting of lumber while sustaining its ecosystem and habitats. The FIMS maps in 1973 were primarily covered by natural vegetation, while subdivided into approximately 14,000 forest mapping units, or FMU. This mapping exercise led to the conclusion that, in 1973, the potential productive forest area had already significantly been reduced. Because of the development of the mapping systems, the country was able to realize the amount of lumber that was being harvested every year and set more reasonable cutting limits on forestry companies. A solution to this goal is, because Papua New Guinea is a developing country, it may not have the economic resources to fully educate poverty. A solution is, because Papua New Guinea is a developing country, it may not have the economic resources to fully eradicate poverty and solve all of the development goals for the 2015 deadline. However, a positive action the country could take to eradicate poverty is to focus on small regions of the country, working on solving each goal in that area, working throughout the country. Although this may take an extended time to complete, it will allow the government to completely access the entire country. Prior to 2004, Papua New Guinea's debt burden increased steadily. In 2004, the debt burden had reached a high level of about 71% of the country. This sustained level of debt absorbed much of the limited public budget. Many considered this as the most important impediment for developing and as the most important challenge with regard to the achievement of the MDGs. After 2004, the improvement in the economy enabled the government to reduce debt levels from 71% of the GDP in 2004 to 35% of the GDP in 2007. New Guinea is a member to a number of international organizations and is signatory to many international agreements, including the World Trade Organization, the Economic Partnership Agreement with the European Union, the Asia-Pacific Economic Corporation, and various other bilateral and multilateral agreements within the Pacific region. It was realized that PNG's membership to these international organizations can impact in several ways on its ability to achieve MDGs. It is possible that the opening up of trade barriers and liberalization will lead to economic growth. Papua New Guinea has signed and entered into various trade liberalization agreements, lifting barriers to trade, particularly with the WTO and EPA, though tariff reduction on many of its goods. However, existing internal constraints of the necessary infrastructure and technical barriers to trade and quarantine, amongst others to improve efficiency, are yet to build momentum. Hence, Papua New Guinea industries are unable to fully Hence, Papua New Guinea's industries are unable to fully compete on the world market. This may have a negative impact on Papua New Guinea's ability to achieve MDGs. The solution is to increase Papua New Guinea's international relationship. The country should first focus on further reducing its debt, allowing for future governments to have the opportunity to afford aid in advancing their global economy. By reducing the debt, the country can focus on distributing its wealth across developed regions.